How's it going, everyone? This is Dr. Dhoon from Greeley Dental Care, and this is our segment that is a behind the look scene from the lab coat, from the loops, from the scary aspects of dentistry, and just getting to know your dentist outside of the practice. So welcome to Beers with Your Dentist. And just so everyone knows, it's not the first full beer. We're on number 2, so you get some honest answers today. Honestly, I don't think a lot of people grow up and say, hey, I'm a 6-year-old and I want to fix teeth. It's not a normal progression. So the way it worked for me is my mom actually is a pediatric oncology nurse. Now she's retired, obviously. What that means is she worked with kids with cancer for a very long time. And what we would do is when she was on a rotation and my dad was working and she couldn't get childcare, she'd bring both of us to the hospital and she would already pre-arrange it. She's pretty smart. She'd pre-arrange this with the physicians, with the anesthesiologist, with the cardiology department, whoever it was, saying, hey, take the kids for a couple of hours, show them the ropes, show them what this is all about, and we would quote unquote shadow different specialties within the hospital. So from that perspective, we actually got a very good insight into medicine. We got an insight into dentistry because I would do the same shadowing with my dentist, with my orthodontist, with whoever there was. And my brother went into anesthesiology. I went into dentistry. The part I really liked was that they were able to have a good life balance with their families. A lot of you guys know, doctors work crazy hours. They're on call. They do residency. It's hard to raise a family. They are pulled in all sorts of different types of directions, and what they do is exceptional. So I'm not discrediting that whatsoever. Like my brother saves people's lives. He's an anesthesiologist. They'll come in an emergency, situation, and he'll make sure they breathe through the surgery. It's a commendable profession. But for me, what I wanted the work-life balance. I wanted to be able to show up at home at a reasonable time, be with my family, be predictable with my family. And that's a big thing for me is actually being a father who is present, who is going to raise his children the right way.